I'm Jaita Chatterjee and I'm a trainer of spoken English and French language, and I have students across the country. Today I will be moderating a discussion on cervical cancer and human papillomavirus with Dr. Sowmyashree. Dr. Sowmyashree is a leading obstetrician and gynecologist in Motherhood Hospital, Hebbal. She has an extensive experience of over 10 years. She specializes in complex laparoscopic surgeries and high-risk deliveries, and she's extremely passionate about women's health and well-being. She has several publications to her credit and winner of gold medals in academics. Welcome, Dr. Sowmyashree, to this discussion.
Thank you.
So, as we are discussing on a very important topic today of cervical cancer and HPV virus. So, can you please describe what is HPV and how dangerous is it?
HPV is a human papilloma virus. It's a form of virus which is mainly transmitted by sexual route. Okay. So, which causes the cervical cancer and anogenital warts. So, most of the cervical cancer, about 90% of the cervical cancer is caused by human papilloma virus. So, we do have different type of viruses, dividing them into category. Okay. So, among that, virus 16, 18 is the ones which causes mainly cervical cancer, and the other subtypes are also reason for anogenital warts.
Okay. So, what are the testing procedures for this?
Yeah, so the human papilloma virus, from the infection to it converting into the cervical cancer, we have a very long period of about 10 to 15 years. Mm-hmm. So, we can catch the infection at very multiple levels. So, there comes the part of testing for the cervical cancer. So, the testing starts basically at about 21 years of the age. So, all the women should start getting tested themselves for cervical cancer by something called pap smear test. Okay. So, it starts at 21 years of the age. It will be done every 3 years once. And if they are doing the human papillomavirus pap smear test plus the DNA test for the virus, so you can get it done the test every 5 years once.
Okay. There must be some precautions to avoid this virus. So, can you please let us know what are the precautions to be taken?
So, we can prevent the infection plus detect the cervical cancer early. Plus, we do have vaccination also. Coming to the prevention part, the human papilloma virus is most commonly to cause infections those who start sexual life at a very earlier age, plus those who have multiple sexual partners and poor hygiene, low socioeconomic status. So, how can we prevent this? One is by avoiding multiple sexual partners. The other one is maintaining a hygienic about the genital areas, plus using condoms. In the multiple sexual partners case, using barrier methods or condoms have protection against the papilloma virus getting the infection. So, we do have vaccinations available also, so they can get the vaccinations done. The other part of preventing cervical cancer is by detecting it early.
And who do you think should get vaccinated and at what age?
So, the vaccinations, we have two different type of vaccinations available. We call quadrivalent and the bivalent vaccine. Okay. So, the vaccination should ideally be given between 11 to 12 years of age. Okay. So, it is for both the boys and girls. It should be given. 11 to 12 years would be ideal. Okay. But yes, they can get vaccinated till 26 years of the age.
Okay.
And they from 26 till 45 years, the women can get it vaccinated, but it is not as effective as they get it done before they become sexually active.
Okay. And do you think this is the only way to ensure protection against this virus? The vaccine is the only way to protection?
Vaccine plus using precautions plus detecting it early.
So, you would not advise vaccine for the people who are not sexually active? That is not required.
No, they should get vaccinated before they become sexually active. Then it will be more effective. Okay. Once they become sexually active, it will be less effective, but still you can get it done as the benefit of doubt. It works over about 40% effective. It will be once they become sexually active. That is between 26 to 45 years of age.
As we know that WHO has declared that cervical cancer is the 4th common cancer globally for women. How common is cervical cancer in our country, in India?
So cervical cancer. So almost 50% of the cervical cancer among the world is detected in Asia. Among that, 21% is contributed by India. So about 1 lakh women get detected with cervical cancer every year.
Okay, that is a very dangerous
Yes.
situation. Do boys also need to get vaccinated?
Yes, both boys and girls should get it vaccinated because the HPV virus can also cause anogenital warts.
Okay.
So the boys who are undergoing vaccination should get a quadrivalent vaccine done.
Okay.
So which will be effective for genital warts.
And since this vaccine is again also very new, do we have any allergic reactions or any side effects of this vaccine?
No, the allergic reaction is not commonly detected. For those who are really have allergies for the other medications, should just get it tested before they get the vaccination. But otherwise, commonly we need not test it for allergies, and no recorded side effects of the vaccine as such.
And another very important questions that people might have in their mind is: this vaccine affect fertility?
No, not at all. It is not going to affect fertility, and it is not related to the women's fertility in any way.
So nice of you, doctor. We had very important information about this. I would like you to sum up that an early detection and treatment, how important it is to avoid cervical cancer, the spread of this cancer in women.
So if we catch the cervical cancer very early, it is 100% curable. Like, we have to detect it early. That's why it is very, very important that every woman undergo the timely testing. Plus, those who are eligible to get the vaccination, please get vaccinations done. So it is available at most of the centers. So please do speak to your gynecologist and get vaccinated. The cervical cancer is almost 99% preventable. We do have protection plus the early detection.
Another question I have, that is, how often should women get a gynecological checkup done?
So this is one part, every 3 years once. And coming to the other type of cancer, where the breast cancer,
yes,
there's something called self-breast examination, which all the women can undergo.
Yes.
So once you become 40, so probably you should have more visits with your gynecologist. You're 40 and above. And if you have a risk factors, like, in case of breast cancer, if you have a family history of breast cancer, or you think you will come in the high risk category for any of the cancers, so do speak to the gynecologist. So depending on which category you fall in, so we will be able to tell you about how frequently you need the consultations
done. So nice of you, doctor. We had expansive knowledge now about how should we get our testing done, when to get the vaccine, and how prevention is always better than cure. Thank you, doctor.
Thank you.